patient develops a hammer toe, it's really on a spectrum, because I have patients that have a mild hammer toe deformity or a very gross hammer toe deformity. And the hammer toe deformity is really the pull of the toe in the up direction, and what happens is it rubs on a shoe and people get these little calluses on the top of their feet, on top of their toes, or at the tips of their toes. And what happens is, over time, they become very uncomfortable. Now, the hammer toe deformity is in a progressive state. So it may start out as a small hammer toe, which is a very small deviation to the toe, and you get a little, maybe a little dark skin up on top. Then it develops into a larger deformed position. And that's because the extensor tendons and the flexor tendons are not balanced well. And when people walk, it's a very fine balance between what their musculature and their feet are actually doing to stabilize the foot and the toes. And where you see the imbalance, for the most part, of an imbalanced foot is either in a bunion deformity or a hammer toe deformity. So the hammer toe deformity is corrected by removing part of the bone within the toe, and that allows me to take a toe that's like this and put it into this position. And we usually lock the joint in place so they don't get a recurrence. Part of the problems that I've seen over the years is that patients have gotten a recurrence when they've had surgery done elsewhere. There's very little stabilization of the joint that's deformed. What I do is put a little digital implant within the joint, no pin sticking out, but a little digital implant within the joint that holds the toe straight while it's healing. And then once the bone heals in the correct position, the procedure is finished. Then the implant essentially is not needed anymore, but we don't take it out. You don't feel the implant, you don't see the implant, but what the implant does is allow my patients to take a bath sooner. There's no external pins sticking out. So the procedure takes about 15 minutes to do. The toe's straight. It takes about 4 to 6 weeks for the toe to heal. While it's healing, you can walk on it. And this is a type of procedure we've made a lot of progress with.